Είμαστε έτοιμοι να συνεχίσουμε. Το θέμα της επόμενης ομιλίας είναι η εποπτεία των κανονισμών. Είναι σαφές τι πρέπει να γίνει. Η ερώτηση είναι το πώς θα γίνει. Θα μιλήσει γι' αυτό ο επόμενος ομιλητής, ο Dr. Umit Kartoglu, ο οποίος είναι ειδικός επιστήμονας ποιότητας, ασφάλειας και προτύπων του Τμήματος των Βασικών Φαρμάκων και Προϊόντων Υγείας του Διεθνούς Οργανισμού Υγείας. Παγκόσμιου Οργανισμού Υγείας, καλύτερα.
Okay. Kalimera. Good morning, everybody. It's a great pleasure to be with you here today. This presentation is going to be about the new technical supplements that World Health Organization is to be issued to support the model guidance for storage and transport of time and temperature sensitive pharmaceutical products that was published in 2011 as the technical report series. I would like to explain a bit what this model guidance was about. Model guidance that appeared as the Annex 9 of the technical report series in 2011 is designed for regulators, logisticians, and pharmaceutical professionals in the industry, government, the public sector as well, and in international agencies. It is directly applicable not only in least developed countries, but also in industrialized countries as well. So we are here speaking about the minimum standards of doing things right. In doing this model guidance, in developing this model guidance, the work that we undertook was we went through every single country, member states in the world, whatever regulation or guidelines or directives that they had in the handling of time and temperature sensitive pharmaceutical products. We collected all of them. It piled up something like this in all sorts of languages. Everything was translated, and we put everything in a kind of a matrix. Where do they overlap? Where do they have conflicting recommendation? And where do they have gaps that none of these regulatory documents is addressing? And based on this, we discussed with all the agencies. There was a working group of total 44 people, starting with United States Pharmacopoeia, Health Canada, from South Africa to Lebanon to Japan to Ghana, all sorts of countries, both from industry and from the public sector. Took about 2 years to come to a conclusion to agree on the minimum standards. When we were doing this work, it was the time that USP 1079, the equivalent of GDP of European guideline in the US, and the European GDP was in the, and also Health Canada, the document that they have 069, was also in the process of revision. And they also contributed a lot. As an example, I want to give you, for example, it's required that when there's a temperature excursion in storage facilities, there should be an alarm. So what do you think that the minimum standard for alarm should be? What kind of alarm should go off in the facility first as a minimum standard? Yes, you can ask for SMS, but SMS is not the minimum standard. The arguments were as follows. We said the minimum standard for an alarm is a visual alarm, not the audio alarm. must is visual. You cannot have an audio alarm without a visual alarm in a facility. First, you must have a visual alarm. The reason was, you may have hold on. The visual alarm, you may have a deaf person working in a storage facility. But you will not have a blind person working in a storage facility, you know, logistically. So he can see. Everybody must see. So the visual alarm was the minimum to start with, and then the audio comes on top, and then the other type of, you know, one level up, it can send email, it can send SMS, the other type of alarms come afterwards. So these were the things that these model guidance were incorporated into. In general, guidelines tells what needs to be done. They don't tell how these things should be done. If you look at EU GDP guidelines, you will not be able to get how to do these things. It says such and such must be qualified. It says such and such must be validated. It doesn't tell you how best you can validate your shipping container. It doesn't tell you how you qualify a refrigerated truck. If you have a fleet of 10 Mercedes trucks, do you have to qualify every single of them? Or you can qualify a sample of it? When do you have to re-qualify the truck? Or if this is a cold room, where are you going to put the sensors? Okay, it says that you must do a temperature mapping study. When do you do the temperature mapping study? Do I do it empty? Do I do it half full? Do I do it full? Do I do it wintertime? Do I do it summertime? How many sensors I put? Is there any formula that if this is 100 cubic meter, that per, for example, 20 cubic meter put one sensor? Where is it? So if I do my mapping study, one auditor can come and cite me because the person is not satisfied with my temperature mapping study, and the other one says, okay, you know, you did a good job. So what are the rules? Or what are not the rules? What are the best practices that can help both the public sector and the industry to be able to cope with the guidelines? So this was the main idea of developing the technical supplements to explain how best these things can be done. So in technical supplements, we're explaining literally how this could be done. So it was written in, and this is a direct quotation from the model guidance. It says, the intention is that the guidance in this document should be directly applicable in less developed countries as well as in the industrialized world. To this end, supplementary materials will be developed to show how these requirements can practically be achieved, particularly in resource-constrained settings. So we're not going for the, not necessarily always for the highest technology that could solve the problem. So these are the list of technical documents we have been working on since 2011. So it's been 2 years full. Now, majority of them are in the final draft mode that will go for extensive commenting period, which we will also, I need to ask, do we have everybody's email address? Yes. And we will also share these documents with you, so you also have a chance to put your opinion, to give your comments, your criticism, so we can improve these documents. So if you look at the titles, it starts with the port handling, custom clearance procedures, estimating the warehouse storage capacity, and goes down to temperature monitoring of storage areas, mapping, qualification of the stores, qualification of the transport, how to handle materials, temperature route profiling qualification, qualification of shipping containers, and it ends up with the environmental management of refrigeration equipment. A total 18 documents. All these documents have the same structure, that everything starts with the abbreviation that we use in these documents, and there is a glossary that we define the terms so everybody is on the same page. When we say qualification, what do we mean with qualification? Where it differs from the validation, for example. And then we explain the requirements and objectives of this particular technical guidance, technical supplement, and then we explain the procedure, how things could be done. And there are related documents and references wherever it applies to other technical documents or other guidelines issued or other standards. For example, there are environmental standards in some senses. And it has a revision history for the future versions whenever we do a revision, so we add a note and explain what part of the document was revised. So to go through this to explain how it works, so the one on the left is a page from the model guidance. So the one that is framed up over there is exactly repeated in the technical supplement over there under the sorry, I made a mistake. The one on the right side is the model guidance, and the one in the frame is exactly repeated in the, for example, temperature mapping of a storage area, because it explains the requirement, why it needs to be done, and what needs to be done is repeated over there. And then the below section, it explains the objectives of this particular guidance, the target audience, who should bother with this one, and associated materials and equipments that you need to have in your possession in order to be able to perform this technical requirement, and it goes to the process afterwards. So everything in these technical supplements are defined step by step. Do this first, do this next, and so on. And we provide as much detail as necessary. Some technical supplements are 10 pages. There are some supplements that are 20 pages. It depends on the process and the detail that you have to give, how these things should be done. Wherever applicable, there are criteria for acceptance. For example, when you do the temperature mapping, and then in order to define what the cold point is, what the hot point is, the warm point is, it gives you the definition. If it is below this, if it is above this, this is the acceptance criteria. Or when you do the qualification of the routes, for example, it gives you the approval criteria for you to come to a decision with your test. Everything in these documents are freshly redrawn from the scratch. It's not taken from different publications and so on. And there was an artist redrawing everything, so we have the same look in every single document as a whole. And wherever necessary, we included flowcharts in terms of following the process properly. And wherever necessary, we added blank forms. So if you're doing a qualification study that you have to record the results, so there are blank tables at the end of each document, wherever applicable, so you don't need to create your own forms yourself. In terms of references and annexes, we give references to international standards and other references. including some articles. If everything is in public domain and do not have any, copyright issues, and then we give the hyperlink. There are some documents, even we can give the hyperlink that you have to purchase. For example, you cannot download USB 1079 if you don't pay. You have to buy it. And then we give the annexes. In terms of communication, what are we going to do as the next steps? So these documents are now to be distributed to all WHO committee members. When I say committee members, these are the expert committee on biological standardization and pharmaceutical preparations. There are two big committees in WHO, so it goes to all committee members. All regulatory agencies in the world, in member states, for example, Greece, I don't know what you call it, FDA, regulatory agency, medicinal regulatory agency, will also receive these documents, supplements from WHO for review. Ministries of health of all member states, international organizations, public and private pharmaceutical industry, supply chain professionals for comments. It didn't go out yet. It will go beginning of 2014, but we can distribute to this group before 2014 because I'll give the copies to my colleagues. And after this all finalization, we will incorporate these technical supplements into several syllabus that we have in WHO. The first one is Pharmaceutical Cold Chain Management on Wheels. It's a training course that takes place in Turkey, and 2014 it will also take place in Greece as the first time in its history. And there is an e-learning course on pharmaceutical cold chain management, so we will incorporate all these technicalities into this course flow. And of course, there will be a lot of presentations in international gatherings and meetings and conferences and seminars to communicate these documents extensively. For example, this could be considered as one of them, I would say. In 2014, there will be a cold chain conference in Brussels, March. We have a slot over there that we will be explaining the status of these documents. There will be PDA meeting, IQPC meetings, and VIB cold chain events. Electronic publishing will come in fourth quarter of 2014. And here's my email address, which will be written when you receive the documents as well. So please take your time. This is your chance. So you can put your views, your voice to these documents. We do consider every single comment as valuable. We incorporate whatever we can. If we do not agree, we do come back to you and we say why we don't agree and why we cannot incorporate what your suggestion, no matter how many comments we receive, because this is part of our job. Thank you so much.
Θα ήθελα να σας ενημερώσω ότι μπορείτε να απευθύνετε ερωτήματα και στα ελληνικά στους ξένους ομιλητές, καθώς υπάρχει ένα σύστημα ταυτόχρονης μετάφρασης που λειτουργεί.
Mr. Kartoglu, thank you for your presentation.
Πιο δυνατά, Παύλο.
I would kindly like to ask you if you could say a little bit more about the cold chain on wheels.
Sorry. I was trying to, but I don't know.
Yeah.
Why are you here in Greek?
I can say it in Greek if you like. I mean, if it's easier. So I would like for you to say a little bit more about the bus course, the cold chain on wheels.
Okay.
Because that's an event that maybe some people here would like to know and participate probably.
Okay. So thank you, Pavlos. So the course Pavlos asked me to explain a bit is called Pharmaceutical Cold Chain Management on Wheels. It happens on a bus. We've been doing this course since 2004 in Turkey on different routes. So the ingredients of the course is, there's a bus, we have 15 participants from mix of industry and public sector. We have 3 mentors. One is me, the other is Kevin O'Donnell from US, and the other one is Jim Vesper, he's also from US. Nobody lectures in this course, nobody gives any lectures. So bus moves on a route from one location to another at different facilities in the supply chain. We go to a manufacturing facility for distribution, we go to a private warehouse, we go to a public hospital, see the pharma depot, and then the pharmacy of the hospital, and then the refrigerators in the patient wards. We also evaluate a retail pharmacy on the street, a health center, all different parts in the supply chain, and a government, for example, vaccine store or a pharma store for, say, Saloniki area, wherever all these supplies in the public system is stored. So we let participants get into the facility. Of course, there's a lot of logistics planned before this course. So they have 3 hours, for example. They have a task that they have to, for example, evaluate what is good that they are doing in temperature monitoring in this facility, and how are the things that they can improve. So you have 3 hours to work with the staff. You review all the documents. Whatever you ask, they have to show you. So you make your judgment as a group, and then, for example, if we started in Athens this course, and the next stop is, I don't know, somewhere else we're going, we stop on the way in a rest area, we storm the restaurant, in or out, and then we turn this place in a kind of classroom for ourselves. Everybody eats and drinks and prepares their work, presentations, and then when it is done, participants start explaining what they have found in this place, and the mentor's role gets here. And then, they guide the discussion. This is why we don't lecture anybody. So all conclusions of the facility are being done all together. We, as mentors, we also learn, because each time we say the different facility. And then we come to a conclusion. Since this is a learning activity, we do write a kind of report after the presentation that goes to the facility, but it is informal, because they open their doors for us to learn. There are 18 different eyes with different expertise giving such recommendation. They like it, they take it. They don't like it, they can forget about it. We're not auditing these places. So it takes 6 days. 1/3 is on the road, 1/3 is we're working, 1/3 is fun. We have a lot of fun as well. So it's a kind of learning by doing experience. It's a course where nobody lectures, but the learning curve is very, very high. So this year we don't have the route yet, but together with Mediline and Elegia, the Greek General Practitioners Association, we will be, together with WHO, organizing this course to take place in early September 2014. Route to be decided. So don't miss the fun, please. It will be announced, so you have the chance to be one of these 15 lucky participants on board. Thank you.
Μπορούμε να συνεχίσουμε με τις ερωτήσεις αν έχετε.
There is one over there.
Hello, I'm Sofia Lukeri from Virbak, Greece. According to my understanding, and pardon me if I'm wrong, the cold chain, the GDP guidelines actually stop to the pharmacy or to the clinic. They don't go as far as to the patient. So I'm thinking that all the pharmaceutical companies are paying a very high effort for the GMP and GDP, and in the end there are no guidelines for the pharmacies or inside the clinic, either inspections, and maybe there are lots of risk factors for the product and for the patient as well. I don't know if there are any thoughts about that, if who has implemented different guidelines on these aspects. Thank you.
Well, this is, of course, this is a very critical question that you're asking, that it has actually two aspects, which we call usually the last mile. The first one is the service points, which is the, for example, health center or the hospital clinic that deals with the patients directly, or a retail pharmacy. That's it. And the end user. It's very difficult to put, rules to the end users. I mean, you can't police them, you can't audit them, you can't make them. If he has to keep the product refrigerated in the house, you can't go and check his house whether he's keeping it in a refrigerator and make a citation next time. If you don't keep it, I'll do it. It won't work. But of course there is a great, very heavy responsibility at the service level, whomever is the one who is dispatching this product to the person. Maybe it's not you dispatching, but you're writing the prescription. The responsibility of the doctor, who has to explain how this product should be handled. And also, greater responsibility falls on the shoulders of the pharmacist in this regard. There are a lot of studies that shows the time and temperature sensitive pharmaceutical products are not handled as they should be at this level. Most of the times, they are given without any validated forms in a nylon bag with an ice pack that, could be exposed to freezing temperatures and whatsoever, or sometimes nothing. In Geneva, my mother uses Zalatan, which is a cold chain product. I know the stability. Even I carry it in my pocket, nothing will happen until I go home. But I don't care. So I go to pharmacy, I say, I give the prescription, and the lady puts in a nylon bag and he gives it to me. I said, if I'm not mistaken that this is a cold chain product, why you're not? And I said, no, it will be okay. I said, no, I'm not taking this. I want to see the responsible pharmacist. And then when I said I'm a doctor, and then I'm coming from World Health Organization, that was a kind of, something happened, and the pharmacist came. I said, look, I know nothing will happen to this because I'm going home. I'll be home in half an hour. I can even carry this for a day in my pocket. Nothing will happen. But not everybody knows the product stability. So you have the responsibility. I said, I'm sorry, there are a lot of lay people who will come and put this product to the trunk of the car and park outside. There is, sun. Even in a temperature of 20 degrees, in a sun, for example, the container metal, in 2 hours, what do you think that the temperature inside would raise to? In a tarmac, for example, 2 hours, metal container, outside is 20 degrees, under the sun. Inside temperature goes up to 70 degrees. There are studies. So I put this product to the trunk of my car, it's gone. The only way to regulate the pharmacies, I don't know how it goes in Greece, either through the pharmaceutical association of the country, that they have some responsibility in terms of auditing, and also regulatory agency from the Ministry of Health, they also have the responsibility. I guess the lady who was speaking, asking question, who can confirm how it is arranged in Greece, it's different in different countries, so I really cannot give a global answer, but there are authorities who have the right to audit pharmacies and make them follow certain rules. They just have to be activated and reactivated all the time. Or maybe you would like to explain how it is arranged in Greece? Whose responsibility? Ministry of
The Ministry.
Yeah. Any other? Okay. Thank you so much. I'm also here. I'm not going anywhere, so we can have talk in between. Thank you.